Hi everybody, this is Dr. Dunnam. This is June, so every month has its own little special thing in eye care. This month for June is National Cataract Month, so we thought it'd be appropriate to make a blog video discussing some cataract issues that a lot of us will face eventually in our lifetime. Basically, cataract is when the lens inside the eye gets cloudy. The lens inside the eye is behind the iris, which is the colored part of your eye, and that lens is responsible for helping us to focus light that comes into our eye to see. For most people, cataracts are typically caused by exposure to UV light over time. So to help kind of reduce the amount of cataract development, it's important to wear sunglasses, safety protection, hats from the sun. Different medications, different other types of eye surgeries, or any trauma can also cause cataracts. Our diabetic patients can develop cataracts a little bit quicker than some of our other patients, just because the increase in blood sugar, if it's a little bit out of control, can cause that lens to change, and cataracts can develop quicker from that. Cataracts cause a decrease in vision over time. As they get worse, they scatter light. So a lot of glare issues, especially if you're noticing that lately driving at night, car lights have this glare around them. They have this starburst pattern around them. That can be caused from cataracts. It also causes just a dullness in vision that usually is a pretty slow change. Most people don't notice that until after they may have had cataract surgery and may have one eye that still has a cataract and the other one that has a lens implant in it. That's usually by the time that they notice, oh, things are a lot brighter than they used to be. I didn't really notice that it had happened. Cataract surgery, since we're going to talk about that a little bit, is usually a pretty quick thing to have done. It is an outpatient surgery procedure. It takes 15 to 20 minutes around about, for a cataract surgeon to do that. Ophthalmology is the one that will do the cataract surgeries for us, but there's over 3.5 million cataract surgeries done a year in our country, and it's a pretty safe procedure to have done. Most people can tell a pretty significant difference in improvement in their vision pretty quickly after surgery, and that's a good bit different from what cataract surgery used to be 30, 40 years ago. When there were hospital stays involved with that, and it took maybe a week to two to really kind of start to improve from that surgery. Of course, there are some things during cataract surgery, healing time, as far as drops and restrictions and certain things safety-wise that we try to make sure our patients do and follow to heal up from that, but it overall is pretty quick and safe to heal up. So the cataract inside the eye during surgery is replaced with a lens implant, or an IOL for short. That lens implant can keep someone corrected for just distance, is pretty standard. Sometimes if someone has a lot of astigmatism in their prescription, a toric lens implant can be used to correct for the astigmatism. Or if a patient decides, hey, I want to see distance and be able to read pretty well without glasses, after cataract surgery, then a multifocal lens implant could be used. Those are specialty lenses, and they do cost extra that insurance doesn't always cover, so there's some extra costs associated with that. But that's a few things on cataracts and a little bit about cataract surgery. Hopefully that was helpful and informative. If y'all got any other questions about cataracts or anything else, any one of us at any of our Progressive Eye Center locations, and I'm here in Paragould, in Piggott, so we'd love to help y'all out if y'all need us anytime or have any other questions. Thanks for listening.